Hi, it's Chris here from the Leicestershire trading team, and in this video we're going to be looking at donning and doffing PPE using the guidelines from the NHS, Public Health England and the World Health Organization. PPE only works if it's worn and fitted correctly. Incorrectly wearing PPE can result in the PPE being as ineffective as not wearing it at all. As you could imagine, this massively increases your risk of becoming infected. Taking off PPE in the wrong sequence can still cause spores or droplets from viruses or bacteria to land on you or for you to breathe them in. So despite wearing PPE correctly, taking it off incorrectly can still cause you to become infected. Finally, not wearing PPE correctly could cause you to wear too much or equally too little. This can result in PPE wastage or even worse, inadequate protection. PPE stands for Personal Protective Equipment and includes items such as gloves and aprons, masks and visors. These are the most common items in the healthcare industry, and these ones are the ones we'll be looking at today. But PPE can also include hard hats, steel-toe capped boots, stab vests and Wellington boots. It just depends on what sector you're working in and what task you're undertaking. PPE is essentially workplace equipment used to protect employees and to keep them safe while they're carrying out work-based activities. This is all governed in the UK by the Health and Safety at Work Act 1974 and the Personal Protective Equipment at Work Regulations 1992. Personal is often an overlooked aspect of PPE. Personal equipment doesn't necessarily mean that it belongs to you or it's under your ownership. It does, however, mean that it must be personalised to you. For example, if you or your patient have an allergy to latex, you must be provided with latex-free equipment such as latex-free gloves. If you're wearing foot protection, it must be in your corresponding shoe size. Fitted equipment must be fitted to your shape and size. This can include items such as a mask, a hard hat or a stab vest. And this is to ensure it adequately protects you while you carry out your work-based task. The personal in personal protective equipment also means the equipment has to be personalised to the task. For example, wearing a blue apron while handling food, or wearing a white apron when carrying out personal care. It is important to remember that it is the organisation that should be buying and providing PPE. As an employee, you mustn't be buying or providing your own PPE in your workplace, unless it's been agreed and you are fully reimbursed by that organisation. There are plenty of occasions when you must wear PPE. Here's the top 5. Number 1. When handling known or potentially infectious material. Number 2. When handling bodily fluids. Number 3. When assisting a person who has a known contagious infection. Number 4. When supporting someone with personal care. Number 5. When undertaking reverse barriering. This is when you are supporting a person who is prone to an infection, such as someone who is receiving cancer treatment. The NHS, Public Health England and the World Health Organization all agree this is the best way to don and doff PPE. Step 1. Ensuring your hands are clean. We have a full video on exactly how to wash your hands in the correct way. After this video, feel free to pop over and check it out. Step 2 is putting on the apron. You do this by putting the apron hook over your head, which gives you 2 hands free to make sure it's tied securely behind your back. Step 3 is putting on the mask. We use the loops to place around our ears or use the lace to tie the mask around the back of our head. It's important to remember that both your mouth and your nose must be fully covered by the mask. Step 4 is putting on the visor. This is to protect your eyes. Now there are many different types of visors, so it's crucial to ensure that this one fits correctly. That means it covers the full length and the full width of your face. Step 5, and our final step, is donning gloves. Some procedures require you to do something called double gloving. This is where you put 2 gloves on each hand, which means when you take the first glove off, it still gives you a clean pair underneath. As we've seen, doffing PPE is one of the most important aspects to prevent you from becoming infected. Let's have a look at how to do it properly. Step 1 is removing your gloves. To do this, remove one glove and then place 2 or more fingers in the other glove. This way you're only touching the clean inside and not the potentially contaminated outside. You then use these fingers to pull the glove and take it off your hand. Step 2. Once we've removed our gloves, we must ensure we carry out effective hand hygiene. Step 3 is doffing the apron. You do this by taking the hook, putting it over your head so you can fold the apron on itself. You then take the ties round the back, undo them so you can take the apron off. Step 4 is doffing the visor. You must remember not to touch the front of the visor, as this could be contaminated with potentially infectious microorganisms. Step 5 is removing our mask. We do it by unhooking the laces around our ears or by untying the lace around the back of our head. We then make sure that we pull the mask straight away from our face, and this reduces any droplets or spores from landing from the mask onto our face. Step 6, and the final stage, is to wash our hands to ensure they're fully decontaminated. So that's it for this video. I hope you've enjoyed learning how to don and doff PPE correctly. Feel free to like and to share this video so other people can enjoy it too. And don't forget to subscribe to our YouTube channel or check out our website for more information about PPE among many other things. So as always, stay safe.